All right, a short while ago, I just got done recording a live stream with Dr. Ken Berry. Now, many of you guys that follow me probably also follow Ken. If you don't know, Dr. Berry has been a keto advocate for many, many years, and more recently has switched to more of a carnivore-ish approach. He calls it his proper human diet. And Ken and I had a really nice conversation. A couple topics that came up that I think are of interest, and one we talked about. The kind of the diet that we're being recommended, the so-called grain-based diet, which in other times would have been a slave diet or a peasant diet or a prisoner diet or something along those lines. And we talk about the fact that not only is it an inferior form of nutrition, and traditionally the peasants were forced to eat grain, whereas the royalty or the nobility was dining on, wild boar and deer and other types of meat items, where that was very infrequent for the impoverished classes. But not only is that something is being sort of pushed on the population, but we're being gaslit into believing that that is the healthiest thing we should do. We should eat this slave diet, and that's a diet, and that's how we'll be healthy. The other concept, which I thought was really important in that discussion, and you can tune into Ken's channel to see the whole stream if you want to, but some of the high points for me, we talked about, the healthcare system and where it's going. In my mind, and I think there's good evidence to see this, that we will see a large percentage of your day-to-day physicians and healthcare providers being replaced with AI, because AI, quite honestly, is better at diagnosis than many physicians are, and will be certainly in the next coming few years. And so what you'll see is an interface where instead of going to a doctor's office, you might interact with some sort of computer terminal of some sort, perhaps your phone, who knows, and there'll be some way to maybe take a little blood sample, maybe a finger prick, that can be analyzed very rapidly, and diagnosis made, and maybe pills brought by an Amazon drone dropped off at your door within a few hours. I mean, that's likely where we'll see some of healthcare going, if it isn't already going that direction. And the physicians, there'll be a physician in the background signing off on all this stuff, because a medical license will be required. But it'll make the pharmaceutical companies very happy, because they don't have to pay these damn physicians. They don't have to bribe physicians anymore to hawk their pills. I mean, they don't have to take them to fancy conferences and bring their office staff all these free lunches and all that other stuff. So that's where medicine is going to be going in many ways. And the drug companies are salivating at this process, because it'll save them a lot of money, and they'll be able to make more pure profit. And, for some people, they'll like it. Some people literally, you go on these, rate your doctor websites, and a lot of the ratings are, my doctor always refills my prescription on time. It's very easy to get refills. That's their metric by which they think a good doctor is in some cases. Whereas, you should be thinking about, well, maybe the metric should be, my doctor got me off the damn drugs and fixed me. And that's one of the things that Ken and I talked about. What we're doing at Revero, I mean, it's exciting. We talk about how much better it feels to be as a doctor when you're actually helping people, when you're not just refilling their meds all the time. It's such a joy to be able to practice that way and to do what your true calling was. When you go to medical school, you never thought, or you never dreamed that you would one day just be a machine that hands out pills like a friggin' pill Pez dispenser. Here's your pill, here's your pill, here's your pill. But instead, that is where healthcare has largely gone. And one of the things that Revero is doing, and the market will dictate. You'll have those people that are happy in that other system where they just get the immediate feedback on their pills, versus another alternative where it's like, hey, let's not make you sick anymore. Let's get you off medication. Let's get it so you don't need medications. And so we talked, a little bit about Revero. And of course, Ken announced that he and some other low-carb people are forming something called the American Diabetes Society, which is kind of a counter to the American Diabetes Association, which many people would argue the advice they're giving is at best suboptimal, and in fact, in some cases, maybe even harmful for a lot of diabetics. But the fact that they don't emphasize nutrition, particularly low-carb nutrition, is, in my view, quite shameful. Anyway, so I just wanted to share that with you guys. I had a good time. Ken had a large audience. I think we had something like 11,000 people on the live stream. Let me know what you guys think about the slave diet, the peasant diet. Do you feel like we're being gaslit into believing that that is the healthiest way? What are your thoughts on the direction of healthcare? You know, do you see what I see with the automatization, the rise of AI, the dependence upon AI, the reduction in the bringing us closer and closer. You think about it, the United States and New Zealand are the only countries in the world where pharmaceutical companies are allowed to advertise direct to consumer on TV, and you know the doctors, the only sort of the thin layer between just go to the damn drug company and get everything you want, as long as you're willing to pay the price. All right, guys, have a great day. We'll talk to you soon. Bye bye.